Hi, my name is Patricia Galam.
And my name is Lauren Ferranda, and we will be presenting on the role of occupational therapy within the area of social interaction amongst children with autism spectrum disorder.
According to Heather Miller-Koenig and Renee Watling on their guest editorial titled Occupational Therapy, Meeting the Needs of Families of People with Autism Spectrum Disorder, or ASD, children with ASD have a range of difficulties that lead to impairments of social functions that affect family life, such as difficulty understanding social rules and conventions, restricted repetitive behaviors and interests, and also limited social skills. Adolescents with ASD are more likely never to see their friends outside of school, be called by friends, or invited to social activities. Also, there is a higher stress for the family and the caregivers of the children with ASD than those who have other disabilities. And occupational therapists are known to be experts for sensory and motor challenges in children with ASD. However, occupational therapists can offer more than that. Their skills and knowledge allow them to address the contextual factors that affect performance and also to use a holistic view of a person and all of his or her interrelated systems and functions. They can also provide the intervention necessary to facilitate independence and participation in meaningful activities, such as interacting socially. The Triad Social Skills Assessment was created by the Vanderbilt Kennedy Center, a treatment and research institute for autism spectrum disorders. This assessment evaluates the social profiles of children with ASD, identifies their strengths and challenges in the social domain, and provides recommendations for intervention planning through individualized goals and specific strategies. It assesses the children's knowledge and skills cognitively through their abilities to understand other people's perspectives, behaviorally through their abilities initiating and maintaining interactions, and also responding appropriately to other people, and effectively through their abilities to understand basic and complex emotions. There are 4 sources of information that are incorporated into this assessment. A parent report providing descriptions of the child's social skills at home and in the community, a teacher's report providing descriptions of the social skills of the child at school, and observations of this child's behavior made by the teacher and the parent, and a clinician's assessment based on a direct child interaction, which consists of a conversation of 4 open-ended questions, role plays, social understanding, and a social motivation activity. These information are interpreted in terms of the child's strengths and weaknesses. Here is the sample report. This protocol provides open-ended questions for the clinician to ask the child during the conversation. During the interaction, the clinician checks observed features of verbal and nonverbal behaviors used by the child and marks the items at the bottom of this page. These are the question cards that are used in the joint attention activity of the social understanding part of the clinician's direct interaction with the child. They assess whether the child establishes joint attention and/or recognizes the need for the other person to see what is on the card in order to answer the question. The child picks a card and asks the clinician all the questions on it. The clinician records whether the child shows card appropriately. These photos are used for the feelings and situations part. They assess the child's recognition of emotions as portrayed in the pictures, as they relate to his or her own emotions and to others' emotions. The clinician assesses the child's understanding of emotions and ability to understand others' emotions. For each item, the child is shown the picture and the clinician asks a set of questions and records the child's responses on the protocol. On the bottom of the picture is a birthday picture. This birthday picture is presented during the context activity part. It is used to determine if the child can use the surrounding context of information in the picture to ask various questions, such as whose birthday is it?
What is the weather like outside? And what does this family do in their free time? Also, it can be noted whether the child focuses on irrelevant aspects of the picture or becomes overly focused on one part of the situation, not considering the whole context. When the clinicians start the role plays, he or she asks the child these background questions. The clinician presents one role play card at a time and reads aloud or asks the child to read. The child's responses and observed verbal and nonverbal behaviors, and any prompt or cues are recorded on the protocol. The social motivation activity is designed to assess the types of activities that the child enjoys and the child's interest in interactions with other children, and therefore requires the child to complete these checklists: things I like, things to do, and places to go, indicating if she likes to participate in the activity not at all, a little, or a lot. From these checklists, the examiner asks the child further to decide whether he or she prefers to do the activity alone, with other kids, or with family. Cards for each activity and involvement level are placed on a 5-point rating scale ranging from likes not at all to a lot.
On their article, Evidence-Based Review of Interventions for Autism Used in or in Relevance to Occupational Therapy, Jane K. Smith and Martin Armsman discuss occupational therapy interventions that have been implemented to address the social interaction challenges of children with ASD, and those are developmental play-based approaches that emphasize positive affect, nonverbal communication play, social relationships and classroom structures, developmental interventions that use visual cueing and visual learning to promote learning and communication, activities that use cueing, prompting, and reinforcement to enhance turn-taking, sharing, communication, and social interaction, cognitive-based social skills training that incorporate simple, discrete steps of social skills which were modeled, explained, and practiced, and relationship-based interventions to improve social emotional growth in children, and those performed with adult limitation implemented high levels of positive responsiveness, applied cueing and prompting, facilitated peer interactions, established environments that support social interactions, and demonstrated positive effects on social engagement in children with ASD.
In addition to the previously mentioned interventions, a review done by Kelly Tanner, Brittany Ann Han, Jean O'Toole, and Allison E. Lane examined the effectiveness of interventions to improve social participation, play, leisure, and restricted and repetitive behaviors in people with ASD. Individuals with ASD experience difficulties with the occupations of play, leisure, and social participation. As a reminder, our focus here is on social participation. It is the role of occupational therapists to provide an evaluation and treatment of occupational performance issues. The study sought to review the effectiveness of interventions within the scope of occupational therapy that are used to improve social participation and the other areas mentioned, as well as to enhance the quality of occupational engagement for individuals with ASD, as well as to improve their health and well-being and to reduce the stress of the caregiver. This is to guide occupational therapists working in schools, the community, and clinic-based settings to select evidence-based approaches for treatment. Each of the interventions described had to be delivered solely by an occupational therapist. There were various social skill interventions that were examined. There was strong evidence found for the use of group-based social skills training programs within the clinic setting and contextual setting. This type of intervention involves a therapist leading a group of individuals through a training program or curriculum. A more descriptive example of this type of training was explained on the Giant Leaps Occupational Therapy website, which states, in a small group setting, individuals learn and practice the essential elements of friendship. A variety of themes such as what am I feeling, winning and losing, and listening to others are explored in the context of engaging in play activities and crafts. Children learn how to identify feelings in themselves and others and learn how to talk through the miscommunications and conflicts that arise in their play. The outcomes of these types of interventions are an increase in social skills, social communication, and positive interactions, as well as a decrease in autistic mannerisms and negative interactions. Other interventions that can be used are activity-based interventions, computer-based interventions, and social stories. There were also various social communication interventions that were examined. These were the Picture Exchange Communication System, or PECS, as well as naturalistic behavioral, developmental, classroom-based, parent-mediated, sensory motor, imitation, and joint attention interventions. PECS and joint attention interventions showed the greatest strength of effectiveness. PECS incorporates the exchange of pictures or icons to facilitate functional communication. Here's an example of some pictures. Joint attention training interventions seek to improve the individual's ability to engage in joint attention, which is an early form of social communication. Improvements in social communication, socialization, cooperative play, joint attention, and the rate of initiation of communication were seen. In conclusion, there are many ways in which occupational therapists can work to improve the social skills of children with ASD. Although some interventions show great promise, there is still future research that needs to be done on the different approaches. Thank you for your time.